Hello, everybody, and welcome to another episode of WWT Experts. My name is Brian Felt, and I will be your host today. I am super pleased to be joined by Dr. Sanaz Cordes. She is a Chief Healthcare Advisor here at WWT. She brings with her a wealth of knowledge and expertise. Her resume is well established. She's been a speaker, she's been an expert, she's been an investor, she's done everything in the healthcare industry, and I am super pleased to be joined with her today. Dr. Cordes, thank you so much for joining.
Thanks for having me, Brian.
So you joined WWT Experts about 12 months ago, and you spoke exclusively there on the patient experience. Today we'll be speaking about the clinician experience. But real quick, let's set the stage here. Walk me through what has maybe changed in the healthcare environment over the last 12 months, and then talk a little bit about why patient experience and clinician experience are so closely linked.
Yeah, absolutely. 12 months, I think healthcare changes exponentially in 12 hours these days, so it's a lot to cover. If I had to kind of boil it down in the last year, what's kind of been top of mind for the state of industry, I guess number one, it would be AI. It's not a new concept. We've been talking about it in healthcare for well over a decade, but now it's on steroids as everyone wants to talk about large learning models and ChatGPT and robots taking our jobs. And so we can talk a little bit about that during the session, but lots of advances in AI. Challenge has not changed, though, in terms of clinician experience. We still are working to overcome sort of the adoption and trust around AI, but we can chat more about that. I guess number two, labor shortages / access to care, those continue. Some studies indicate that, it's slowing down and things are looking better. Others indicate the opposite. So really health systems are learning to do more with less every day. And so that really puts automation front and center, which we can touch on. So finding ways to remove tedious, repetitive tasks off people's plates and use technology to increase, capacity. And then I guess third, this has probably been, the state of the industry for well over 10 or 15 years, but data, right? And so now the conversation around data has expanded. So it's not only how do we access it, how do we share it, how do we interpret it? It's also, how do we keep it safe? How do we make it equitable? How do we make it liquid? So that would kind of be the summary of the state of the industry. And then, patient experience being tied to clinician experience. I mean, at the end of the day, everything everyone does inside a healthcare organization's walls is ultimately for one goal, right, which is patient care. I just met with a health system CEO last week who knew every employee by name, every initiative that was taking place inside his walls. And when I commented on it, he said that he never loses sight of the patient, that's why he gets up every day. And so everything he and the staff do is to ensure that the patients receive the best care that they can. And so I think that's really important. And so when we think about, the clinician experience, the patient experience, it's no different than anything else, right? Happy people have more bandwidth to use their minds. And so it allows them to free up their minds to do critical thinking, innovative thinking, planning. When your mind isn't occupied by distractions or unhappiness or negative thoughts, you're more clear and you're able to give more of yourself to those, that you serve. And so this is absolutely true for clinicians. And so I think, they need to feel safe, supported, valued, and given the resources they need so that their patients are taken care of and have a better experience themselves.
Well, it's certainly been a whirlwind for clinicians, patients, everybody within the healthcare industry, and I think a lot of us can empathize with the amount of work that they've put in, but the incredible work that they're doing is also leading to an uptick in dissatisfaction among the clinicians. Talk about why that is and what can be done to improve that experience. Yeah,
unfortunately, the satisfaction in the job for clinicians does continue to decline. Now, recent Press Ganey survey suggests that it's declining less quickly for physicians, but it's still declining year over year. And the statistics are, kind of staggering, right? Like over 50% of physicians report being burnt out compared to like 40% before the pandemic. Over a fifth of them say that they have, signs and symptoms consistent with depression. 20% plan to leave patient care. That number has not slowed down since 2021. And it used to be that primary care topped the scale for burnout. So we were always kind of focused on, how do we make that a priority? But now we're seeing, the ED docs level of burnout is north of 65%. And when you talk to, all these specialists across the board, the number one contributor for dissatisfaction is burdensome bureaucratic tasks. And that encompasses, electronic health record, right? Now I think the average is docs are spending like 1.84 hours a day outside of their workday, just documenting in the EHR. So, these numbers are not good. We had 100,000 nurses leave the profession in the last 2 years. And a recent report suggests that there's going to be 600,000 more that plan to leave, by 2027. So there's a lot that we need to really focus on, to make things better.
So it's fair to say that healthcare organizations are placing a greater emphasis now on increasing that clinician experience. But I assume it's not just a switch that flips and say, okay, now we're going to make the experience great. So where are most of the healthcare clients that we are advising today? Where are they at on their journey to improve that experience for the clinicians to ultimately drive those better patient outcomes?
Yeah, you're absolutely right. Clinician experience has been a stated goal, a stated, initiative for health systems for years. Myself starting in the healthcare startup space in 2012 focused on this very topic, citing folks like Christine Zinsky, pioneer in the joy in practice, people process technology, taking burdens off clinicians, doing things like pre-visit planning and inbox delegation and all that. So that was, 2012. So it's not a new concept. But if we fast forward to today, 11 years later, it's no longer kind of an aspirational goal for these health systems. It's a survival goal because of those stats, right, that we just talked about. Health systems are suffering from contract nursing costs. It's like 2.5 times to pay for a contract travel nurse than a staff nurse. And these labor shortages are causing closure of services, right, and care, and causing them to go on diversions. And then the staff that do remain are getting more burnt out because they're caring for, more patients than they ought to. And so patient outcomes, getting projected to get worse as we see, baby boomers joining Medicare every day, margins being super low. So the clinician experience, like I said, it's now a survival goal for organizations. And so where are our clients? They're everywhere on the journey. I'm always impressed, and shouldn't even be surprised anymore at how innovative some of our clients can be and some of the topics they bring to us that are really disruptive. And we can chat about some of those that could really move the needle. But if I had to sort of bucket things into kind of like two categories of what can be done or what's being done, I would say there's like technology is the enabler in terms of like clinical and operational workflow improvement, right? Like doing things with tech to make both the clinical workflow and then all the stuff that, clinicians have to do outside of patient care better, streamlining it, automating it, whatever. And then there's the bucket of like employee well-being. We kind of talked about that a little bit, but technology plays a role here in, well-being, which in workforce well-being encompasses things like support, protection, work-life balance, job satisfaction. And we can talk about how, there's technologies that can help move the needle on that as well.
Well, you had mentioned technology as an enabler to help the clinician experience. And we know from talking to clients that that same technology or technology trying to be implemented typically becomes a source of frustration for clinicians. So what can be done to smooth out that process, and what types of technologies should organizations be prioritizing now that can help leading into the future?
Yeah, you're right. The EHR, it's like we gave doctors an iPhone, 15 years ago and then didn't put any apps on it, right? And wanted to know why they were frustrated. So we've definitely come far from then to now. But to your point, what are some, so I can start simple, right? What are some simple technologies that we're seeing and encouraging being implemented for clinical and operational task automation simplification? So if we look at nurses or day-to-day clinical workflow, There's the inpatient sort of surveillance system. So a lot of companies creating these dashboards that consume EHR data, maybe device data, biometric data, and is basically constantly surveying their patients. Nurses have a big patient load. They can't be everywhere at once. So by having these dashboards that can consume, identify risk, and inform, that's a very simple tool. And I say simple, meaning it's not, AI necessarily. And then same with like triage solutions, which I can talk more about that because it's evolved now to where there is more artificial intelligence involved in that. But, things that help identify patients, rank and stack, and get them, in the queue better than just relying, again, on a human running around trying to do that. And then we've seen things like, automated IV pumps and, medical robots and things like that are just the routine, repeatable tasks that nurses have to execute every day, being able to take some of those off, right? And then the pandemic definitely accelerated things like centralized command centers. So having more remote nurses or remote folks monitoring patients so that the, boots on the ground folks are freed up a little bit. So that model, it was already there, for a long time, but we've definitely seen, an increase in it. And then if we look at physicians, clinical workflow, just even a simple chatbot, right? We're seeing, ambulatory inquiries coming to clinics, being able to manage some of those with chatbots. The EHRs have for a long time now and increasingly getting better at putting things in there for like care gap identification. So as a physician seeing a patient, they get prompts on, things they may want to consider or order based on the data being fed, into the HR. Big frustration for clinicians around technology from day one is interoperability and access to information. One EHR instance doesn't talk to another EHR instance, and we see that within a single health system, right? So again, I have to commend EHR companies like Epic, who've really done a lot around this sort of health information exchange and making that information available to physicians when they need it. And then, remote patient monitoring, we talk about that pretty much in every session we talk about in healthcare, but for clinicians, the way that's helping, the way they want that to work is not, I just want all your device data and your wearable data, because then like who's going to sift through that and identify risk? But the organizations that are putting in programs where the data is going somewhere, being consumed, interpreted, triaged, and then appropriately notifying the right team member to do something about it or not. Those are ways that we can improve the experience for docs so that they're not having to be reactive, but can be, more proactive. And those are all clinical examples, but real quickly, I just want to say, there's operational stuff too, right? Like, mobility, like arming physicians and doctors with more mobile options at the bedside, remote, real-time location and wearable devices where we know where the IV poles are or where a human is, so they're not running around wasting time for that. And then things like My Chart Bedside, where the patient is in control because they have a digital point of entry to ask the questions and do the things that historically have been what nurses have been sort of bombarded with.
Well, that's an excellent point that it's on the operations side too. I want to ask if a client of ours is just getting started or wanting to improve that clinician experience, where would they start? Is it diving into a day in the life of a clinician, or do they have to understand all the processes that go into it? How would they kind of kickstart that journey?
I think if we think about where do clinicians live at work, right? Like they live in the EHR for the most part. So physicians, that's where they spend most of their time, and most of the friction is around that, right? So if a health system is truly, new in their journey and kind of taking this on, I would highly recommend let's start there. Let's spend time with your clinicians and watch their workflows and see where are their friction points as they do their day-to-day work inside the EHR. Because there's a lot we can do with the EHR itself to optimize. And then there's a lot of technologies that we can bring in that are EHR adjacent or EHR integrated that can start to automate and remove some of these tedious, time-consuming tasks.
Well, you've mentioned AI a couple times, and certainly we can't get away without asking you about it. I'm sure 12 months ago when you were sitting here with us, you were not having as many conversations about AI, and today I would wager to guess that every conversation you have with a client has something to do with AI. So what automated intelligence solutions are you seeing put into practice now? What's being talked about in terms of implementing at healthcare organizations? And what is really driving towards that success of creating that better experience?
Yeah, I mean, you can virtually take any solution that used to be kind of simple, binary logic, coding, rules engines, and I guarantee if that companies around today, they're implementing AI to take it to the next generation. So even like the ER triage that I mentioned earlier, or the chat bots, now next generation is now we have AI, we have models that are consuming unstructured intake data, biometric data, and generating, doing a better job at identifying hidden risk. And then chatbots, we actually have health systems that are putting their toe in the water with using generative AI and large learning, like private, like on-prem, private, custom data, large learning models to create a chatbot that can actually respond to queries and consume the organizational data locally, right? And so that's, to me, really fascinating. We have, like I said, a couple clients that we're starting to take that journey with. But yeah, I mean, if we think about AI, again, there's clinical decision support tools, so tools native to the HR, tools that sit on top of the HR. They can be at the point of care. So, Epic, for example, has, early sepsis warnings and things like that happen at the point of care. It can also be an actionable insight that happens at a reporting sort of retrospective method. So physicians, at the end of the day, they're responsible for anything that happens to a patient, even if there's no possible way they could consume all the information and be aware. So if we have tools, leveraging generative AI, I think Epic and Microsoft are doing that for their Slice or Dicer reporting tool. These are ways that we can unburden physicians, but also allow technology to do something that a human just couldn't do. And I think a great example of that also is imaging. The radiology space has been very quick to, adopt AI and has seen huge benefits. These images are standardized in a DICOM standard format. They are all viewed in a PACS system. So these standardizations have made it easy for data scientists to create models that can be used regardless of the hardware or technology. So, here even at WWT, we have a white paper where we did brain tumor machine learning computer vision model, and the model was able to identify brain tumors up to 20x faster than humans. So there's so much that we can do to help, radiologists be faster and more efficient, and then increase access to care, for patients, and detect problems earlier and faster, things like aneurysms, cancer, embolism. So there's that clinical bucket. And then, just again, operational charting, documentation. My favorite would be something like, Dragon ambient experience. I remember Dragon Medical One, that was revolutionary in and of itself, just a script service, right? Being able to dictate and have things scripted. But now, being able to have this tool just ambiently listen to a patient and doctor have the visit and then generate a SOAP note for the EHR and then drop it in. I mean, if that doesn't make the clinician experience better, I don't know what could. So we have a lot of folks that are using that at our client organizations. And then around RPA, robotic process automation and, surgical robots and things like that. Of course, we've seen that for a while, and they just continue to advance. And I guess the last bucket would be like smart hospitals. I think definitely that can move the needle on clinician and patient experience so much. And just because you digitize things or you're digital first organization doesn't make you smart. It's not, so smart hospital doesn't mean digital. It means connected information coming in, being consumed, and allowing something to happen like an automated next step or, enhanced decision making. So being able to, gather information from medical and non-medical devices, things like the parking kiosk that the QR code lets you know the patient's there, to location tracking like we talked about, or even the HVAC system, which needs to be different in the chemotherapy ward than in a different ward. Like being able to take this information, put it somewhere, digest it, and then have an action that comes out of it, whether, again, that's a notification or a downstream like next step. I think that intelligent operationalization of all the stuff that's happening in IoT in your hospital is crucial. And I don't know how that wouldn't help, anybody working in the hospital by kind of automating and streamlining some of these things.
Well, certainly between AI and other emerging technologies, the potential to drive positive outcomes is incredibly high, but there's still business to consider. So I want to read to you real quick a quote that we had from a client, which reads, "We need cost efficiency to reinvest into the transformational stuff, but it's painful and slow, and the economics of the industry are making it even harder." So talk about the industry and what healthcare organizations are going through, and then what IT leaders or business leaders, what they can do to pitch or make the case to invest in these transformational technologies such as AI.
Yeah, I love that quote because it's true. Years ago when we would bring up innovation and solutions and things like AI, again, I don't want to say they were like aspirational, but they were like cool and shiny objects, and health systems wanted to do it. And sometimes that was enough, right? Like to make a compelling value proposition if you're a vendor selling those tools. Sometimes that was enough, but more and more now, IT purchasers, health system leaders that are making purchasing decisions, they want to only invest in things that have an ROI because they are squeezed, right? Like we have less, I think last I read it was like 0.2%, operating margin for organizations when it used to be like up to 4%, less than, 5 years ago. So they don't have the money to get nice to have that are shiny. And so in order to make purchases, they are asking for what is my near-term, long-term return on this investment, because I only want to invest in things that are going to drive efficiency, cost savings. So then to your point, it'll allow me to increase capacity, have more revenue to be able to do other things.
Well, something a little bit more practical in the short term is employee well-being. What types of technologies are you seeing right now that can really drive that? And how is that improving the clinician experience, ultimately driving positive patient outcomes?
Yeah, I mean, we talked a little bit about when we think about, well-being, it's things like, supporting, protecting work-life balance, job satisfaction. And one doesn't necessarily immediately say, oh, clearly that's technology can solve for that, but it really can. And I've been so excited and honored to be part of engagements like that at WWT, where, even things around nursing labor shortages, nursing dissatisfaction, building solutions, a unified digital point of entry, a mobile app, web and mobile app that, allows nurses to go to one place to do things like shift management, schedule management, continued med ed, licensure, that kind of stuff. Like if they could just go to one place and manage things in a less friction way, then we're really making them happy, right? And if we make them happy, we can recruit them, retain them, and allow them to thrive. So that's one of my favorite things that I've seen happen. But even like workplace flexibility. Nurses are tired. They want to leave the profession. They've had a very hard, few years. And so how can we allow them to stay and do something hybrid or something different? So things like, remote virtual telemedicine options, letting nurses do that, maybe hybrid or fully to provide care remotely. And again, helping them, the ones that are in the hospital, boots on the ground, freeing them up to do other things. So we're seeing, a lot of programs like that continue to thrive. And then unfortunately, nobody really wants to have to talk about workplace safety, but it's very real. 70% of ED docs, 40% of nurses have been physically assaulted at work and have been victims of physical violence. So again, how are we seeing our clients implement technology? So smart cameras, detecting aggressive behavior, facial changes, raised voices, weapons, And then mobile duress systems, right, where we can have the real-time location services, and then have some sort of panic button or device where people can call for help. So I think a lot of these things all kind of fall under that bucket of well-being and allowing folks to enjoy their jobs so that they stay in their jobs so that they can drive better patient outcomes.
Well, Dr. Cordes, those are all the questions that I had for you today. I appreciate you joining, and thanks for coming and shedding light on what is a very important topic for a lot of our clients that we have today.
Thank you, Brian.
And thanks to everybody for joining here today. You can go see all of our back catalog of episodes of WWT Experts at wwt.com/events, and we'll see you next time.